Hey there, South Florida, and to everybody else, of course. Welcome to Moms of the Mic. Glad to be with you.
We are going to be talking about vaccines today, specifically for kids and several other COVID-related issues. And we certainly want to get whatever questions you may have. You can ask them live, and we'll be able to ask them right here, get you an answer right away from one of our local pediatricians here in South Florida.
Yeah, we're really excited to be doing that because, of course, with this rollout, now vaccines being available for kids 5 and over. Marissa and our kids are younger, which, by the way, I'm Julia. This is Marissa. I don't think we said that, but want you to know the latest information from doctors, right? Because parents, we've been talking to other moms and dads, and they've got a lot of questions.
Yeah, a lot of people, working hard, have other things going on in their lives. They hear about the vaccine for kids, and they're not getting maybe direct information. Maybe they're hearing other things online. So we really want to cut through all of that and just be able to get you some answers right away from a trusted pediatrician here in South Florida. And having said that, let me go ahead and welcome her onto the chat here. This is Dr. Danielle Squires. Thank you so much for being with us today.
Hi,
really
Dr.
appreciate
Squires.
your time. And Dr. Squires, for those of you who maybe don't know her, she's actually a local. She grew up right here in Miami, a product of the University of Miami as well as the University of Pennsylvania. And she's had a local practice here down in Pinecrest for about 7 years.
Yeah, that's right. So she's from Kings Bay Pediatrics, and she's a mom like us. So let's get started. Dr. Squires, we know your son is 6 and you just took him to get vaccinated. Tell us about that.
Yes. So I have 2 kids, ages 3 and 6. So my 6-year-old, that's him right there. He went for his vaccine on Saturday, which was the first day that it was available. I took him to Walgreens. It was really seamless. I made the appointment online. We showed up. They were welcoming. They were prepared for kids. He got a lollipop at the end. It was a great experience.
Awesome.
And I know you had mentioned he was really excited about it. He'd been talking to his friends about it. Tell us about that, how he was feeling.
Yes. Well, he's a pediatrician's child. So he has been closely following COVID. He's been following the vaccine. He knew that it was coming. It had been under review by the FDA. And when it was approved, he was ready to go. He goes to school and tells all his friends that he's going to be getting the vaccine and that now he had, a little bit of trepidation for the actual pinch, but he laughed after and said he hardly felt it.
Oh, and so this was over the weekend. How's he feeling now?
Great. He had no issues. I was anticipating at least a sore arm, but he really didn't feel much of anything.
No, that's great. We love to hear that and love to hear his excitement. Maybe he'll go into medical school as a teenager, right?
He wants to.
So there's so many other parents, right, who are thinking about doing what you just did this past weekend. Other parents not wasting any time doing it now. What might you say to anyone who, is kind of on the fence, maybe not rushing in to bring their kids? Why should they go ahead and not waste any more time?
I think the sooner that we can get those vaccines in arms, the safer, your child is, the safer we all are. Unfortunately, we're coming into the holidays and exposures, may increase over the holidays. The study that was done on kids that, was released by PFIZER was, very convincing. It showed a robust immune response, over 90% effectiveness in kids, similar to adults. And, very, manageable side effect profile, the most common being a sore arm. Like adults, kids may have fever, fatigue, some of those other, side effects in the day or two after they get their vaccine. But really minimal in terms of side effects, and the benefit is just tremendous.
Dr. Squires, one mom I was just talking to the other day who tells me she's a little nervous about it because she feels like this is still so new. And so that's kind of her trepidation. What would you say to her perhaps when it comes to vaccinating her 3 kids?
I absolutely understand. And it is new for 5 to 11, but it is not new for everyone. And when we look at how well we've done with this vaccine already, we've given hundreds of millions of Americans this vaccine already. It's the same vaccine that mom probably already received. Her child is going to get, although a smaller dose. So it's about a third of the dose of the Pfizer vaccine that an adult would get. But we've had, about a year of experience now with this vaccine. And in the, kind of adolescent population, 12 and up, we've been giving it since May. So we've had a good amount of time to kind of observe it and to manage and monitor the side effects. Vaccine side effects present themselves. Typically you see them right away. So, we have kind of good data here to monitor. And I don't know if you want me to talk a little bit about mRNA vaccines.
Go for it.
That, I think everyone worries, has concerns because it's new. It's new for us, but it's not new in the scientific community. I think that's the other thing we need to realize. We've, started studying it since the 60s. And then, looking back through the 2000s, the last 2 decades, it's been studied numerous times with lots of different other viruses. So we've had a lot of time to look at it and study it and are pretty confident in how effective it is.
Well, and you mentioned side effects there for a moment. We just got a question in that I want to go ahead and pose to you here.
Sure.
So the question comes from a mother named Marie. My daughter is a cardiac patient. I'm super scared to vaccinate her because of the side effects of the vaccine. Don't know what to do.
Okay. That's a great question. Because, when we look at the general population, the recommendation from the American Academy of Pediatrics is get this vaccine. And kids with, chronic illnesses, other issues, it's still get this vaccine. Those kids are more at risk usually from COVID. I will say that, with specific cases, that's when you want to talk to your pediatrician. And in this case, your pediatric cardiologist. I can't get into the specifics without, of course, knowing the case. It should be safe for really almost everyone. But when you're not sure, that's what your pediatrician is for.
And we spoke kind of in depth about myocarditis, right? Mm-hmm. And kind of a little bit of the misconception there that people have of the side of, that being a side effect with the vaccine versus the actual virus. So let's talk about that a little bit, how rare it was to begin with the vaccine and how it's actually more common potentially if your kid gets sick, right?
Yes, you just really summed it up. But absolutely. Myocarditis is a rare side effect of the vaccine. It tends to be most prevalent in general, in the general population in the teen years and 20s and in males. So we're going to see it in that group, vaccine or not. It is a very, very rare, on the order of like 1 in 50,000 side effect of the vaccine. However, from COVID, the number of cases of myocarditis from COVID are exponentially higher.
Wow.
Orders of magnitude higher. So I think sometimes parents don't realize that, while of course we're going to monitor our child if they have a vaccine, and we're good, and it's good that we're talking about these things. But in terms of relative risk, not having the vaccine and getting COVID is still so much riskier.
Wow. So just to be clear here, for parents with concerns, with cardiac concerns for their kids, when it comes to myocarditis, you're actually running a much greater risk. If you were to contract COVID, you're at a much greater risk for myocarditis compared to getting the vaccine.
Exactly.
Gotcha.
Yeah, it's just interesting because you hear it so much tied to the vaccine, right? When that's not really, reality. But I think that's also maybe in part because there's so many other things tied to getting the virus and so many other ways you can get sick. So maybe that, myocarditis isn't getting as much play.
Exactly. I think it gets lost in some of the other also very concerning things about COVID and the ICU visits and the COVID pneumonia and some of those other issues.
Sure. Doctor, I just got a question here from another parent, a mom wondering, what about kids who have had COVID? What about them getting the vaccine? Should they wait? Can you answer that?
That's a great question. And the recommendation from the American Academy of Pediatrics and the CDC is absolutely get the vaccine. Those kids probably will end up with the best immunity of everybody. So yes, absolutely still get the vaccine.
Okay.
And really, I think, and I don't think that 5 to 11-year-olds yet have access to the monoclonal antibodies, but that's the only instance where I hear that you do need to wait to get vaccinated or your booster shot, correct?
Correct.
If you actually get the monoclonal antibody, then you want to wait a certain time period to get the shot, correct?
Yeah. Yes, exactly. And that, that I would go under the guidance of my physician if that were your individual case.
So really the basics here, if you have other questions, about your child's condition, whatever that may be, talk to your pediatrician, right?
Mm-hmm. I know I always laugh because I see lots of discussions and on mom groups, and they can be a great way to get information. But when it comes to, your child's health and the specifics of your child's health, your pediatrician's going to know best with, that's what we're here for. We're here to partner with parents to take great care of your kid.
Doctor, why was it so important for you to take your son right away?
Oh, I've been waiting for this. I truly feel that, getting everyone vaccinated is our path back to normalcy, back to getting our kids on sports teams and engaged in activities and having play dates and birthday parties, all the things we want to give our kids, that, travel to see relatives. So the sooner that, I can feel safe that my children have immunity and have been vaccinated, the sooner, we can go back to doing some of the things that we've held off on over the last, year and a half.
So today, actually, in Broward County, there's 14 different schools that are starting to administer the vaccine to 5 to 11-year-olds. And that it skips tomorrow because it's Veterans Day. But that's going to continue from Friday and then beyond, I think all the way into March, vaccinating children in Broward at the elementary and middle school. And I know Miami-Dade County has a similar plan where they're starting this week, if not in the next couple of days, to do the same. So there seems to be so many reasons out there to vaccinate your child. But another one is also that there's still a group under 5 who don't have access to the vaccine. And every child that gets vaccinated or person now 5 and up can help that younger age group. Can you talk about that a little bit?
Absolutely. And like you, I have a 3-year-old as well, so she can't be vaccinated. And even among, adults and older children, there are children, maybe who have immune compromised or cancer patients, and they can't be vaccinated, or they are, but they don't have the same immune response. So, if you think about, your child going into a classroom with other kids, we want to protect everyone. We want to really, take care of our community. I think, one of the main things that have come out of COVID is like, how can we rally together as a community and take care of each other?
Sure. And, you were talking about it, Doctor, Marissa has, so we have 4 kids between the two of us. All of them are under the age of 5. The oldest just turned 4 on Saturday. Right. And so I know, for their safety, right, I feel like the best I'm doing is the fact that we're vaccinated. And in fact, when I took my son, Ethan, I took both my kids, Ethan and Sophia, to the pediatrician a few weeks ago. My son had croup. My daughter was coughing, so I wanted to get it checked out. The first thing the pediatrician said to me, she asked me, "Are you vaccinated?" And I said, yes. And just the relief in her voice from that. So tell me about, when it comes to these younger kids, how far does that go? Us being vaccinated and, bigger kids, bigger siblings, like in your case, to help protect these little ones.
Absolutely. Whoever we can, we're cautious about who we're around, all of us nowadays, because we just, there's the risk is still out there and we don't know, but we really want to, cocoon them. We want to surround them with healthy individuals that are protected, in the same way that you, when you have a newborn and, you make sure that everyone around them has their flu shot or, whatever it is. It's the same idea. I think whatever we can all do to protect each other, and the little ones are still, unvaccinated, so they're still vulnerable. So I absolutely agree with you. Whatever you can do to surround them with healthy people.
And there may be, I know some parents out there, argue that, well, kids don't get it as much. And if they do, they're asymptomatic and it's not so bad. But, we've talked about that there are still serious cases out there, of kids getting COVID. So talk to us about what you've seen in your practice, what has been seen at the ICU. And unfortunately, I know that there have been a few kids in this age group, 5 to 11, who have passed away.
Yes. And certainly more kids have passed away from COVID than flu in a typical year, which, people always try to liken it to flu in this age group. There's definitely a difference. And if you look at, kids in general, we're looking at about 700 children who have died of COVID in the United States since this began. And that's not counting the kids who ended up in the ICU, kids with long haul COVID, kids with, multi-organ system inflammatory type problems that have come up after the fact as well. So, there's definitely, an increased disease burden from COVID compared to your regular childhood illnesses. And, I see it every day, even if it's things that we consider more minor, maybe a child coming in who has persistent headaches for several weeks. But it's not a simple cold. It may look like a simple cold. And fortunately, many kids, that is all it is for them, but it's not everyone. And we can't discount that.
Right. And I mean, doctor, the scary thing for me, that I know another pediatrician mentioned to us is that it's hard to tell. Sure, if a child has these comorbidities, we know they may be more susceptible to really getting to getting very sick. But sometimes, like you just said, you just don't know what it's going to be like for your sick. You don't know if it's going to be smooth sailing if they get infected, or if it's going to be worse.
Right, especially with the Delta variant, right? Healthy children were getting sick more often.
And as a parent, I'm sure you feel the same way. I would never want to have this moment where I say, I wish I had done it. I wish I could have done more to protect my child, and I didn't do it. And that's how I feel about the vaccine. I think it's, it's putting a seatbelt on, strapping your kid into a car seat. It's the same, the same idea.
Sure. And, I mean, on a personal note, we lost somebody close to us, not a child, an adult, who was unvaccinated. And that has certainly stayed fresh in our minds, and, just kind of motivated us to share this message, and, how important it is.
Right. And also to check in with people. I mean, I think there was a time where you took care of yourself, you took care of your family, and you tried not to, interfere with other people's options. But then we had this very close family friend pass away. And I thought, why did I never ask him if he was vaccinated, or why did I never offer to answer questions, after all the coverage that we've done? So, I think that that's part of it too, is to check in with people. And if they're willing to hear you, to encourage them. I'm sure you do that on a daily basis with your patients.
That's well said. And yes, and obviously it's a balance, but you definitely want to, check in with the people whose lives, intersect with yours, and who you care about. Absolutely.
Sure. And doctor, can you tell us maybe some more about what you're seeing in your office, with kids, and what the conversations are like with parents who have kids 5 and over now?
Well, I think you summed it up when you said in the beginning, there's the families that were there right away, and were signed up and didn't matter what I had to say, they were ready for their vaccine. There's a group and I think it's a sizable one that just wants more information, wants to know more, is still gathering information. And of course, there will be some that just won't get it. But I try to bring it up, pretty much at every visit. I think it's an opportunity to learn, to hear reservations, because sometimes, it's as simple as asking, what is it that you're concerned about? And sometimes it's something I can provide a little extra information. And then, the parent says, that makes sense. And we're going to do it. But I'm having this conversation all day, every day, both at work and just, within the community. And it's the constant conversation these days, that's for sure.
Sure. Well, and something else we've talked about, right, is also just the inconvenience that getting sick, even if your kids are asymptomatic, let's say they test positive and it's, an easy 3 days or easy, right? Parents might have to call out of work, or, things have to change, right? And that's another reason to try to avoid that with the vaccine.
Yeah, absolutely. This permeates not just in illness, but through financial, burden on families and calling out of work and the cycle of one person being sick and then the next and then the next. And then before you know it, over a month's gone by and you've been in quarantine with your family. And that, that has tremendous impact.
And, in a lot of scenarios and conversations, the vaccine has kind of been framed by, the debate over choice, and I'm going to make the decision for my family. And we certainly respect other parents, and we know, you want to make the best decision for your family. We want to make the best decisions for our family. Can you talk about why it's important for a lot of people to receive the vaccine and not just a few, and just kind of how the science behind that, how that works?
Sure. This is a tough one because I agree with you. Every parent is going to do the best that they can for their child, and we absolutely have to respect that. But it's my job to advocate for the individual kids and for kids in general, within our community. And until we reach a certain level of herd immunity, which I know we've all heard talked about over the last 2 years. This is going to keep circulating through the community. So, when we reach a point where everyone's been vaccinated and, certain people have had the diseases as well, and you have antibodies, high levels of antibodies within the community, the hope is that we, the cases really start to dwindle. That's what we're working towards. So, I think, I'll kind of liken it to this. We vaccinate our children for all sorts of things. Polio is a great example. I'm not that concerned about someone contracting polio right now. But the reason no one's contracting polio is because everybody's vaccinated. I mean, we truly have herd immunity. And, I can't think of a time a parent has questioned vaccinating their child for polio. So I think it's sort of like that. I mean, it's sort of, we all do our part and we get our kids vaccinated for all the illnesses with the hope that those illnesses do not make a comeback, but we're prepared anyway.
I want to ask you something else, Doctor. This term that is kind of new to me, but the idea of a twindemic, where we could still have significant cases of COVID-19 as well as the flu. Is that something you're concerned about at all?
Yeah, I'm glad you brought that up. That's definitely something that I'm concerned about. The flu shot, every year, again, we're always convincing families to get the flu shot because most kids do well with flu. But this year, I think, kids, even more than adults, will come in with multiple viruses at the same time. So you might come in and your child might have strep throat and a cold. That's just the nature of kids, especially if they're in school, preschool, early childhood. They get sick all the time. They get sick, 8 to 12 times a year. That's just sort of par for the course. But right now, if you're looking at a situation where you have flu, which can knock you out for a week, and high fevers and coughing and puts you at risk for pneumonia and other things, and then COVID, which can do, many of those same things too, it's definitely a riskier situation. So as we do every year, we're encouraging everybody to get their flu shots. Flu shots and COVID vaccines can be given together. If you walk into a Walgreens or CVS, they can give it to you together. But that is something that we're talking about a lot. Yeah.
Thanks, Doctor.
No, and that's a good reminder to get them at the same time, because even though that's something that you and I know well, a lot of people are still wondering, if you can give that all at once. So.
Right.
And you know what? Sorry to interrupt, Marissa. We have another question here from Giovanna. She says, I'm concerned about the lack of safety studies. Phase 3 trials alone take up to 6 years to complete. This vaccine was approved after 6 months. We don't know all the risks yet. How do you respond to that, Doctor?
So I think we have good data. I think they use true evidence-based medicine when they're looking at these studies. If we're going to wait for years-long longitudinal studies, we're going to have a bad situation with COVID on our hands. But what we do know about vaccines is that we don't see issues long-term. We see issues in the short term. Just like when you give your kids all the other vaccines routinely throughout the year, we remind you, okay, in the first 48 hours, they may have a fever, they may be a little fatigued. It's very similar with this vaccine. So I think we have to, while nothing is 100% certain and there's going to be risks with everything we do, the safest bet is to be vaccinated for COVID. And again, talk to your doctor. If you're concerned about, your child specifically, that's what your pediatrician is for.
Yeah.
And again, just to remind that mom, the study that was done involved 3,000 kids, right? Let's go through that again, just so in case she wasn't listening earlier.
Yeah. So it was 3,000 kids got the active vaccine versus placebo. There was another population on top of that got the placebo. And the side effects were very, very minimal. It was there was no myocarditis within that study. And it was truly, what we've been seeing, a little fatigue, a little headache, possibly some fever, but really very manageable side effect profile.
And something that you said that even surprised me was that we can compare a little bit. It's not exactly, but how this group of children, 5 to 11, are doing, compared to how 12 to 17 did, compared to how 18 and up, right? Because even though the ages are different and the dose is different, it's not as different as the rest of us may think.
Yeah, and it's the same vaccine, smaller dose, so it's even less. But yeah, the 12 and up group. I mean, you look at the kids getting the vaccine now. It's not so different for an 8, 9, 10-year-old to be getting a vaccine compared to the 12-year-old who's been getting it since May. And that age group did wonderfully well, and it was very very effective, and they had a great immune response. So so far it's been very positive.
And Doctor, you sound pretty encouraged about where things are headed. What does this say about us in the pandemic?
I don't want to make any predictions because so far every time we think something, something changes. But I mean, I'm hopeful that our numbers are getting better. I don't know what new variants are going to bring, but I'm hopeful that more and more people are being vaccinated. So I think we take it one day at a time. But I have to be hopeful for the future and for my kids' future, and getting the vaccine is that next step.
Thanks.
Well, and I think it's only been a week that this 5 to 11-year-old group has been able to get the vaccine. But I've interviewed a number of parents who have said to their kids, now we can go visit grandma. Now we can go visit grandpa. So I was just really impressed at how many people were continuing to socially distance, whether the grandparents, were vaccinated or not, just to continue to be extra careful.
Right. Yeah, absolutely. I think it's a mixed bag. I think everyone is willing to take on different levels of risk within our community. But I will tell you from my personal experience, a lot of our friends and a lot of my doctor mom friends have continued to be very, very cautious during this time period. But I will tell you, we're all anxious for that vaccine. Everybody was there on Saturday.
Wow. And just as we kind of wrap things up here, Doctor, what might you say to that mom or dad who's still on the fence kind of about this, and not sure what they should do, whether they should get the vaccine or not for their child?
So I know a lot of parents get their information from other parents and other people they speak to. But I would really recommend looking at evidence-based sources. So when you Google, you'll find all kinds of things. But looking at the American Academy of Pediatrics and their recommendations, I think are the best guidelines to follow. I think we've seen from the vaccine trials and from older children who've already gotten the vaccine that this vaccine has been safe and effective, that the risk of like any shot vaccine or any other thing you do, there's going to be a little risk, but the risks really are minor compared to the benefit of vaccinating your child. So I encourage everyone to go out and get the vaccine, to consult with trusted physicians that can help guide them, and to make sure when you're reading, you look at very scientifically validated material when you're doing your research.
And for those of us with children under 5, what do you think the timeline might be that the vaccine might become available for 2, 3, 4-year-olds and then the real little ones?
I don't know I don't want to guess. I'm hoping within a couple of months we start to find out more information. I think that was the intention, but I haven't heard quite so much lately. So crossing my fingers for sooner rather than later.
All right. And I think, the message I keep hearing both from you, Dr. Squires, and other pediatricians is talk to your doctor, right? Have that conversation about your child with your pediatrician.
Right. Absolutely. Because if you trust us with the care of your child and vaccines and taking care of your child when they're sick, I think that you have that rapport, that relationship. Now is the time to speak with them and let them help you talk through your concerns.
All right. Well, thank you so much for your time.
Yes.
I know you're in between patients. This might be your very important lunch break that you're spending with us. So we just appreciate your expertise, your time, everything. Dr. Squires, thank you.
Yes.
Thank you. It was nice to chat with you both.
We'll do it again sometime.
All right. And thanks to all of our moms and dads. Thanks to everybody watching. Thank you for your questions. And we hope this was some helpful information.
Yeah, I was able to answer some questions for those of you out there. And, we'll continue this conversation here on Moms with a Mic and continue to try to answer any questions you may have moving forward. So thank you again for your time, everybody, especially you, Dr. Squires. Have a great day.
Bye-bye.